Richardson, and we had a health fair today, and I'm actually doing blood pressures and blood sugars. So I'm going to tell you the importance of taking your blood sugar. It is for you to get a basic idea as to how your blood sugar is, and if you are diabetic, to be able to monitor it. To see if it's high, if it's low, whether you need to take your medication, the insulin or something like that, right? So the normal ranges of blood sugar would be 124. So if you go beyond that, you can go to the health center, have it rechecked and stuff like that. So if you have several checks of it being elevated, then you probably need to see the doctor and to be placed on medications.
Good morning, my name is Khalida Banks. I'm a physical therapist here with the Health Authority of Anguilla, and we are here at the Nurses Week Health and Holistic Health Fair. This is our physical therapy booth here, and physical therapy is a specialized form of rehabilitation, special form of healthcare where we deal with recovery, helping persons to recover from various injuries, from stroke, from fractures, from sprains, and various other medical conditions. We are specialists in the musculoskeletal system, so we know about all your muscles, your bones, we know about the nerves, and we provide patients with instructions on how to optimize the use of their bodies and their muscles to prevent injuries and to recover from injuries.
Okay, pleasant good morning everyone. My name is Mrs. Jennifer Gums. I'm the Senior Health Educator in the Health Promotion Unit, Health Authority of Anguilla. Also, we're in collaboration here with the Anguilla Cancer Society at the Nurses Day Wellness Fair. One of the things that we're looking at here this morning is breast health. In the area of breast cancer, we're actually teaching persons how to check their breast. One of the things that we have a replica here, and the replica, this represents the areas where people can feel for lumps or they can feel for mass within their breast. Also too, we have areas here which show persons, how to check their breast, what to look for. This is a breast that is infected. If you look at it good, you'll see that it actually looks like the skin of orange peel. So we ask persons if they have any of these signs and symptoms, they need to check their doctor. This is a breast here that is infected with a lump. This is actually where the lump is. And you can see that the nipples are inverted, and this is a sign that you need to check out what is going on with the breast. This one here, you can see that the redness of the breast, you can see that this breast here is infected. So we're asking persons if you have any of these symptoms to check your doctor. Also too, if a person has to undergo a mastectomy where they have to remove the breast, this is what it would look like. Where this is a surgery, you can see that actually the breast is removed. So if a person has to undergo a surgery where they have to remove the breast, there are things that you can do to go on to live a happy life, which means that you could actually have a replica, or what this is actually a fake breast, but it's a prosthesis, and you'll find but it's kind of heavy. So persons have an option where they can actually have a prosthesis, or they can have what we call a knitted knocker. This is actually a more lighter breast, and it's actually knitted just like the name says, a knitted knocker. There are different sizes. If you look at it good, this size here might be smaller than this size. So it all depends on the size breast you can choose, and they are knitted. They come from the name knitted knockers. So actually they are knitted. So you actually persons knit them and put them together. So basically the tools here that you can actually knit them and put them together. So basically, persons can, with the breast removed, you can actually put them within the bra, or you could. This is a special bra where you actually put the knitted knocker in, or the ordinary bra. You could actually put the knitted knocker within the bra, and if you put on a shirt over this, it comes just like an ordinary breast. So we're asking persons to realize that removing your breast is not a death sentence. It means that if you have your breast removed, you can still go on to live a happy and productive life. So thank you very much for listening.
Good morning. My name is Sibylla Kentish. I'm a retired health worker, I am here today promoting family planning.
Good morning. My name is April Richardson. I am the HIV/AIDS and Sexual Reproductive Health Program Officer for the National Chronic Disease Unit, and I am here representing safe sex and free HIV testing.
Why is it important to do a test?
Well, maybe April is a better person to answer that question.
So, I think it's important to know your status when you're in the community as someone that is sexually active. It's better to know if you are a carrier and you want to get correct treatment, as well as you have a responsibility to the public, to the community, and to yourself.
Well, to know your status, then you know how to manage your life. Yes, HIV is not the end of the world. There's medication around. It's free, so you can manage your status. You can share with your family and friends. You can share with your partner, whether it's your girlfriend or your boyfriend or your wife or your husband. And you can also share with your children so that they could know how to protect themselves and maybe some of the dangers of HIV, because we know that in HIV there is no cure.
Thank you.
In things pertaining to health. Today I'm here representing the Anguilla Family Planning Association, and we are sharing with the public some of the stuff that we offer. So we have guided pill, we have the morning after pill. This simply means if you had sex within 72 hours and you take it, then you should not get pregnant. And you have the Depo-Vera. This is an injection that lasts for 3 months, or some people say 90 days. Lots of people like that because then you don't have to worry after that. And this one is the iodine. Some people refer to it as a coil. And this has to be inserted by a doctor or medical person, and also the injection has to be given by a medical person. But these ones you can take. And here we have a chart showing you all the methods that we have. Side effects, strong points. And we have it in both Spanish. Yeah, because we have a large Spanish population. So we're trying to be inclusive.